So the former health secretary says that young people are being overdiagnosed with mental health conditions. So Jeremy Hunt is backing a report from the Policy Exchange think tank and is calling for radical reform of the special educational needs and disabilities, or the SEND system, as it's also known. Well, joining me live now on LBC News is Jean-André Prager, who's a senior fellow at Policy Exchange. It's good to have you with us this morning. Do you agree then with Jeremy Hunt's position there that young people are being overdiagnosed with mental health conditions?
I think the report outlines that we believe there's been concept creep in some of the way we diagnose mental health conditions, and that is leading to challenges for our public services and not providing enough support for those with the most acute need because of the concept creep that has occurred in some conditions that young people face.
What do you mean when you say concept creep?
Well, I think in the ways that we some of the definitions of some of the mental health conditions that people now has meant that parents have possibly have medicalised some behaviours of children that in the past wouldn't have been medicalised, and they're trying to find a medical reason for why some of this behaviour happens, and we see it in sometimes in the way that people have. Talk about things like ADHD currently, and I think there's a general desire for people to find a reason why some behaviours happen, and that means sometimes they try to find a diagnosis.
Oh, I see. So you think in some cases perhaps we've gone too far the other way in terms of trying to bring any form of medical concept to things. How do we then get the balance then? Because you will find some parents who may be really, really worried and therefore may find some peace of mind in some sort of medical diagnosis. So what do we need to do here? What needs to change?
I think the reality of it is that, when 1 in 5 children need SEND support, we need to make this a new normal, that actually part of everyday society is dealing with additional challenges. And our systems, the systems that we talk about in the report, the disability living allowance, the SEND system, they are systems that were built for small proportions of people, and now they're dealing with far greater numbers, and they're not well suited for the numbers that now are on these systems, and therefore we need to change these systems.
So when you talk about changing the system, then as you mentioned, the child disability living allowance, also the SEND system, what would that change look like?
So in the SEND system, what we think is that we need to make sure that EHCP plans are particularly only for those children in special schools. But mainly our big recommendation is that we have a best practice watchdog so that we can get better and more precise interventions for those who need additional support. And in the DLA system, as you will have seen, the government is looking at what we can do on working age disability benefits, and we think they should also do a review into the child DLA system, because that system was created in the early 1990s, and our understanding of disability is fundamentally altered since the 1990s, yet our system hasn't. And you see this across a range of things, and I think my key point would be that our understanding of disability and special educational needs has changed over the last 20 to 30 years, but our systems haven't adapted to that change.
And the government is saying this. It says it's clear young people with mental health issues have been let down for years, which is why we are transforming the current mental health system through the Plan for Change and our 10-year health plan. Is this something that fills you with some form of reassurance at all?
Well, I think the government are likely to come forward with some proposals in the coming months on SEND. At least that's what has been widely reported. And I hope that they consider what we've written in this report and the wider kind of calls for, on changes to the system, and take some dramatic action.
Really good speaking to you. Thank you very much indeed for your time. There's Jean-André Prager, who's a senior fellow at the think tank Policy Exchange.